Narrow therapeutic index drugs in organ transplantation. Calcineurin inhibitors are the cornerstone of immunosuppression after kidney and liver transplantation. Tacrolimus has been used in kidney and liver transplantation for over 20 years. Tacrolimus is a narrow therapeutic index or NTI drug. It is one of only a small number of registered medicines that are NTI drugs. NTI drugs like tacrolimus have only a small difference between their therapeutic and toxic doses. They also have high intrapatient pharmacokinetic variability. Since high intrapatient variability of tacrolimus levels is associated with poor graft outcomes, individual dose titration and routine therapeutic monitoring are essential. Switching from an innovator drug to a generic NTI drug requires special considerations. Firstly, bioavailability. Generic drugs must show bioequivalence to the innovator drug before they can be approved by regulators. The European Medicines Agency requires that for both the area under the curve and the Cmax, the 90% confidence intervals for the ratio of the generic to the innovator drug lies between 0.8 and 1.25. For NTI drugs, the limits are 0.9 to 1.11. Despite these requirements, switching from an innovator to a generic formulation of tacrolimus can change tacrolimus concentrations in the blood substantially. As switching between different generic formulations may increase the risk of graft rejection or adverse effects, careful therapeutic drug monitoring is required. Repeated substitutions from one generic to another are not recommended. Secondly, formulation changes can confuse patients, and they may make mistakes because the name or appearance of the drug has changed. Such mistakes can compromise adherence and increase the chance of antibody-mediated rejection. A survey showed that while about 75% of patients would agree to accept generic substitution if it was initiated by the consultant, many would not agree if it was initiated by other healthcare professionals. Lastly, while generic substitution might appear to be an attractive option to reduce drug costs, generic substitution of tacrolimus can actually significantly increase institutional costs of care. The European Society of Organ Transplantation recommends 5 key guidelines for the safe and controlled generic substitution of NTI drugs. 1. Only transplant physicians should initiate switches from innovator to generic formulations and between different generic formulations. 2. Only generic formulations that meet the stricter bioequivalence criteria for NTI drugs should be used. 3. Drug levels must be monitored closely after each switch. 4. Repeated substitutions should be avoided. And 5. Patients should inform their physician if the pharmacy makes a substitution.